which is a subsidiary of Zyga Healthcare, and they are a leader in providing home healthcare services throughout the entire DFW Metroplex. Folks, my name is Dr. Paren Makadia, and I will be co-hosting today's show with Dr. Kasif Chaudhry. You can watch us live on our Facebook page, and after the show, head on over to our YouTube channel, The Doc Talk Live, and like us, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. For more details, visit our website, doctalklive.com, and if you are a healthcare professional and would like to be on our show, please send us a request to our website or through the Doc Talk Live Facebook page.
This is Dr. Kashif Chaudhry, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a great show for you all. Allergies are increasing in prevalence. They affect as many as 30% of adult and 40% of children. Allergies are the sixth leading cause of chronic illness in the US. In 2015, 8.2% of the adults and 8.4% of the children were diagnosed with hay fever. Today, our topic of discussion is allergy and anaphylaxis. Joining us in the studio will be Dr. Vidya Sridhara. To be part of the conversation, please call us at 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your questions throughout the show. Dr. Sridhara, welcome to join Doc Talk Live. Thank you very much for volunteering your time and to be part of this show. Please tell our listener a little bit about yourself.
Thank you very much. I am Vidya Sridhara. Thanks for inviting me for another session of Doc Talk Live. I'm an allergist immunologist. I've been in practice in the DFW area since 2012. I have two locations, one in Plano and the other one is in Murphy. And you can get more information at murphyplanoallergy.com.
Excellent. Thank you again, Dr. Sridhar, for coming on our show. Let's get right to it. What do you mean by the term allergies and anaphylaxis?
Great. So allergy is a reaction of the immune system towards a substance, an otherwise harmless substance that the immune system is thinking is an invader. So that substance that is eliciting the reaction is considered the allergen, and the reaction is called allergic reaction or allergy. So in typical allergy, when we talk about it, usually one or two systems of the body is involved, be it nose, and then you call it allergic rhinitis, or eyes, allergic conjunctivitis, or skin, called atopic dermatitis. So that's just involvement of one or two systems of the body. Now, anaphylaxis is a more serious life-threatening allergic reaction, wherein multiple organ systems of our body are acting up together. So there will be multiple organ system involvement, and usually the reaction is more severe, involving closure of the throat. So people usually start experiencing tightness in the throat and then feeling of closing in of the throat. Alongside there will be nasal and eye symptoms. Many of the times it also involves the skin, causing hives, and typically hives are these welts which most people get when they get a mosquito bite, but these hives are many in number, involving larger surface of area. And also this can involve your gastrointestinal system or respiratory system. So the symptoms would be coughing or wheezing, trouble breathing, and vomiting, diarrhea, abdominal cramps. So multiple of these symptoms are shown at a time, and usually the reaction occurs within a few minutes to 1 or 2 hours after an allergen. And the typical allergens that induce this kind of severe reaction are foods, medications, insect stings, and rarely there are other things like radio contrast dye. But typically it's classically seen with foods and medications.
Dr. Sridhara, are allergies curable?
That's a great question and a very common question. So we are not supposed to necessarily say curable, but I'm going to touch upon two different things here. One, we see it in children where they are naturally outgrowing of allergies, and you see this atopic march. For example, we were just talking earlier, eczema. Most kids try to outgrow their eczema And there are certain kids who start having milk allergy or egg allergy, and they naturally outgrow of those allergies. But many other allergies are not naturally outgrown. So we have procedures called desensitization, where an allergen, whatever the patient is specifically allergic to, is introduced into his body in a very graded, slow fashion. So their immune system starts building immunity to that, and that's called tolerance in terms of immunology. So the closest to that we get to curability or cure is desensitization.
Let's take a live caller. Go ahead with your question. You're live on the show. So the symptoms develop, and what are how can you resolve these allergy symptoms?
I couldn't hear. What was the question again? Okay. Okay, I get it. Okay, so the seasonal cough can be a symptom of seasonal allergy, and that could be typically related to one of two things. One is allergy, which causes nasal congestion and drainage, and the drainage is going down the back of your throat, which starts the cough. So that can happen typically in reaction to the allergens that can be pollinating seasonally during whatever season that you're experiencing. One. And second thing is the same allergen can induce some inflammation in your lungs, which can also cause some dry cough issues. So it could be either allergy-induced cough or cough-induced asthma or cough variant asthma. So you definitely need to be evaluated by an allergist to see if you're allergic to the seasonal allergens.
Let's take another live call. Go ahead with your question. You're live on the air. Let's take the next call. Go ahead with your question. You're live on the air.
Pollen allergy is affecting all the people who came from out of state to Texas. After attacking the pollen allergy, I can see the breathing issue and cough, sneezing, itchy, and eyes are red. These are all related to pollen, or is there any other allergy?
So the first question is it only seen in people who migrate from other states? And the answer is no. It can be seen in anybody who is allergic. The people who live in Texas also are the people actually who are more allergic to the different pollens. When you come from outside state also, you could be allergic to the local stuff here, because these allergens are shared across the states in the US and even sometimes in Canada. So yes, everybody who is allergic to a particular pollen, they do experience that. But people, when they come from out of state, they are not used to the drastic changes that happen in DFW. So you could experience more symptoms than you have experienced in a different state here. One. And the second thing is, all the symptoms that you mentioned are pretty classic for the allergies, and if it is happening especially in season, then those could be brought on by the seasonal allergens, be it in spring usually trees are in pollination. During late spring, grasses start pollinating, and then they go on up until early fall, until there is a break. Sometimes there is a break in summer when it's very hot in Texas. In the fall, there will be weed pollen, and mold spores are also seen, especially after rain. There will be more mold spores in the air, causing seasonal allergic rhinitis.
Let's take another live call. Go ahead with your question. You're live on the show.
Thank you for taking my call. But is there any minimum age for allergy test? And secondly, how reliable that test is?
Great question. We were about to go into that anyway. There is no minimal age for allergy testing. It can be done at any age, but it depends on the age of the child as far as what they can be allergic to. Usually, little children, infants less than 1 or 2, 1.5 years of age, do not have as many seasonal allergies because they are not exposed to as many seasons as yet. So, but they could be allergic to foods or indoor allergens that like dust mites or pet dander, which they could, which they probably have been exposed to over the past year and a half, depending on their age. So, yes, they are testable. And the second question was how reliable. The tests are very reliable. The tests have to be taken into consideration based on their history. So the background history is extremely important, and knowing what to test for is crucial. The testing for everything without knowing proper history is very useless.
Okay, lots of caller waiting to talk to you. Let's take another call. Go ahead with your question. You're live on the show.
Yes, I have a question with the doctor.
Go ahead, please.
Go ahead, please.
Yes, when is the right time to start taking medicine for allergy, or you have to take it throughout the year?
That depends on what you are allergic to and what seasons are triggering the symptoms. We typically say start the medications before the season starts, and that is mainly to avoid something called a priming effect. So if you are allergic to spring pollen or tree pollen that pollinates in the spring, then you want to prepare ahead and start at least 2 weeks before, so kind of like around Valentine's Day, to take care of the March pollen.
Let's go ahead and take another call. Go ahead, you're live on the show.
Yeah, hi. I have a question for the doctor about allergies.
Go ahead.
Okay, so here's my question, doctor. My question is that, of course, you're discussing the allergens that people generally, get and get congested, things like that. In my case, I get congested. It's the environment. It's just like in certain days I'm congested. So I had all these tests done for the allergy, and they said, well, I'm not allergic to anything per se, but just the environment. So I'll give you an example. When the barometric pressure, for example, falls down or goes up, I get decongested.
Sir, we're going to actually, I'm sorry to cut you off. We're about to go into the break. We will take your call on off air and we'll come back and then answer your question.
An immigration case. I've tried everything by myself, but I just
Hello?
can't get the hang of it.
Why don't you call attorney